Welcome back. This is Daybreak, and thank you for staying with us. The hashtag on X is Citizen Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikare. Dr. Bashir Isaac is from the Ministry of Health, joins us this morning. Good morning, Dr.
Good morning.
Lovely having you here on the broadcast. Dr. Nancy Barasa is the chairperson, the task force that has been put into place to look at some of the causes of the femicide epidemic. Good morning.
Good morning.
Lovely having you here on the broadcast as well. Rehema Jaldesa is the chairperson of the National Gender and Equality Commission. Good morning.
Good morning.
Thank you for joining us. And Patricia Andao joins us virtually here on the broadcast. She is a researcher, and I'll be taking her account in effect to that. Harriet Chigai, the presidential advisor on women's rights, will be joining us shortly in the course of this broadcast. Let's first take a look at the numbers provided by Patricia and company, and this includes the number of female murders in the last 5 years cumulative between 2020 and 2024. We had 82 cases reported in 2020. This was at the height of the pandemic. 2021, 113. The number then reduced to 67 in 2022, then jumped to 95 in 2023, and 170 in 2024. And let's take a look at how women were killed then and through, which means these are the cases listed by the research done. That includes according to the ranking as well, stabbing, hacking, blunt force, and sexual assault in that order. Where women were killed is another interesting aspect of that research. Nairobi had recorded 28 cases, Kiambu County 16, Nakuru County 15, Kirinyaga County 91, and Kisii County. Kirinyaga County is supposed to be 9. We apologize for that mix-up, and Kisii County 9 among the long list of the other counties where these cases were reported. The number of convictions as a result of these cases: 2020 saw 12, 2021 11, 2022 17, 2023 16, and 2024 had the highest number of convictions at 35. Who then is killing the women? 48% is as a result of what the research found, caused by husbands, boyfriends at 29%, family members at 14%, ex-husband 3%, a friend known to the victims at 3%, and ex-boyfriend at 1%. Where are the killings happening? Homes are supposed to be the safe zones for women or any other entity, including children and male, of course. 61% was the highest. Public space, 17%, and unknown areas where these bodies are fetched, as per the authorities, coming third at 15%. Patricia, starting with you, these statistics are certainly shocking. And how then do you think we can leap away from this point in regards to the figures that you have given us?
I mean, some of the patterns in the data are very clear in terms of where the problem is coming from. For starters, we are seeing that because majority of the perpetrators are husbands and boyfriends, that this is partly a societal issue, but then also when we see the fact that the cases seem to rise when people have economic strain, for example, like in months like January, it also points to an economical issue here that is, putting pressure in households that could lead to detrimental effects. I think also when we look at the fact that majority of these cases are happening amongst young people, both the perpetrators and the victims are young people. So the question we need to ask ourselves here is, how can we mentor young people, especially when they're moving into relationships? And how can we make sure that we create an environment that the moment a victim reports violence, any form of gender-based violence, that a lot of aggressive action is taken to ensure that this does not lead to a murder? Because what we are seeing is that a lot of the victims in our database had a history of gender-based violence before it ended up being a femicide. So there are a lot of things here, even providing a safe place for these women to run to, because some people don't have a place to go when they leave. There are a lot of things that the data is pointing to that we can action. It's very clear some of the things that we need to do. And it's a bit frustrating when we look at, how the money was spent, the 100 billion that was promised to go towards tackling femicide, and we see that they bought a lot of tents and chairs and sodas and and some of the things that we clearly need, like safe homes and gender desks in the police stations, are not being actively implemented. So how can we ensure that these things are done so that by this time next year, we're talking about a significant reduction in numbers?
Okay. Dr. Bashir, how does the government then act on these numbers, given the momentous task and the shockingly high numbers of what we had just displayed for our viewers?
Thank you, Jayub. This has been with us for a while, and I will start with maybe a comment of saying this is a societal issue, as has been evidenced, and it takes the whole society to make a decision. And these women are dying, and GBV is happening because as a society we are yet to make a decision that these lives are worth protecting and worth saving. As government, there are a lot of things that have happened, and I'm sure my colleagues here will allude to that, from issues of legal instruments, the execution of these criminals, to the health services. In the health sector, it comes a bit late to us because it's something has already happened. We have a prevention component of it, but happening at the societal level, as alluded to earlier, is that this is something that takes care of a family unit. Are the kids or are the youngsters being mentored, being prepared to take such a responsibility? And how supportive is the family unit when these things happen? At health, we have policies, we have guidelines, we have documents and data collection tools. We have trained our health workers on how to handle these cases. And we have a lot of programs, but they are piecemeal. We have also coordination mechanism, multi-sectoral coordination mechanism with the police, with the judiciary, with the health workers, with the community. But are our actions or our activities, our strategies really working? Because they are piecemeal. This is a problem that also depends heavily on donor funding. The programs are heavily dependent on donor funding. I don't see government input in terms of resources, direct resources into the software, except the hardware. We have health workers, we have health facilities, but are the commodities available? Are the evidences foolproof? Are we able to take these evidences all the way to the courts and provide evidence? Are the health workers who are witnesses to these issues supported? Do you have a budget line for these issues? Therefore, the government has strategies in place, but it is not just a government agenda. So it's a societal agenda. Financial constraints as well as also
the approach and the working with other players, including the society. So we'll be expounding on that, given the role played by elders, community leaders, religious leaders, as well as including boys and men. And Dr. Barasa, coming to you, the task force, give us the scope of what you look forward to, and are there factors and issues that you'll be focusing on with attention in the course of the duty that now you bear?
Thank you very much. We are expected to adopt a multifaceted approach to dealing with these menace of GBV, including femicide. So we are going to look at the legal, policy, and institutional frameworks to see if there are any gaps that need to be improved. We are going to look at society itself. We are going to look at things like culture. What does culture play in all this? And from where I sit, culture and issues of patriarchy play an important role in GBV. We are going to look at the economic issues. We are going to adopt a wholesale approach to looking at the issue. So it won't be a linear approach. It will be multifaceted. I think that is what our mandate demands of us, so that we get to the root cause. And the root cause, probably if I could add to what Dr. is saying, this is a very, very complex problem. And it isn't starting today. It has been with us, only that the media is now bringing out more. I think more of it is being exposed. Maybe you were very young then when I was working for FIDA, when I was president for the Federation of Women Lawyers in the late 80s, in the 90s. We did a lot of work. In fact, that organization is the first one to come up with the issue of addressing gender-based violence. We launched the first program on gender-based violence because of what we saw as an organization. And patriarchy, where society thinks that marriage is for good, battered women cannot live because society will stigmatize you. We dealt with cases where the women were permanently and perpetually battered in their homes, but they couldn't live. And we witnessed some who died. I remember a harrowing case of a woman called Kavata, Agnes Kavata, whom the media beamed into people's sitting rooms. She died in Kenyatta National Hospital because the husband had beaten her and she had fractured, she had damage to the spine. She growled in our sitting rooms and she died. Those are the women we dealt with, so femicide is not new. Okay. It has been going on. It is the approaches. Women can't live. First, because of stigma, they can't live. We all ostracize women who dare say enough is enough. Okay. Economic issues, as Daktari says, some may want to live, but they cannot support themselves, they cannot support children, and they cannot leave their children behind. So it is a whole circle of problems.
All right. And Dr. Baraza, before I come to the chairperson of the Gender and Equality Commission, one amongst the many issues that also women parliamentarians through KEWOPA who are coming into this discussion have proposed is in their respective constituencies and counties to provide funding for example, tents, chairs, and sodas, as Patricia had pointed out, and we equally did that story. Wouldn't it be prudent if this money then is spent on gender desks at police stations so that these cases can be tracked early, and also the question of providing safe homes for the case of Kavata, like you have mentioned, so that they can be kept and their cases are considered?
Absolutely. If there are instances in which resources are being misapplied, I think that is unfortunate. Tents for what? And sodas for what? And whatever else for what? I think we need to appreciate that this is a country which is struggling, like many other countries are struggling economically. So the little resources we have, we must apply it prudently. And as you say, we need shelters, we need desks in the gender desks, which we did as FIDA. We placed gender desks in every police station. We trained police. Even in Giganjo, we used to go to train the police, and they became very gender sensitive in receiving and dealing with reports of
Is that still happening today from FIDA?
FIDA, I don't know, but that is a program that we set up for the first time. And so Kenyans' concerns about how we use resources is quite legitimate. And I can assure Kenyans that my committee, we are not going to drink sodas and do all those strange things. But I'm sure there was a reason they were using tents. I'm sure. But we'll see how we can prudently manage the resources. We don't have much.
Okay. Madam Chairperson, good morning to you again.
Good morning.
How does the Gender and Equality Commission, which is tasked now with the question of not looking at it from the boy or the girl perspective, the man or the woman perspective, but look at this horrifying reality of what's before us as a country?
Thank you, Ayub. Let me start by, first of all, congratulating my two friends here, Dr. Nancy Baraza and Dr. Bashir, who, by the way, was my classmate at high school, for being appointed into the task force. He's in the secretariat. And I want to remind them that we are really looking up to them so that they can come up with a very concrete proposals that will address these manners. Back to your question, Ayub. National Gender Commission, as you've rightly put, is mandated to promote gender equity and equality for all the special interest groups. In that special interest group, we have women, we have youth, we have people with a disability, we have minorities, we have elderly, and we have the PWDs. Of course, the Commission is struggling to meet its mandate due to inadequate funding. As has been said, that resources is a challenge in the government. Having said that, we've done our best to try to engage the public. And just a week ago, my team were in 5 counties. We're in Muranga, we're in Meru, we are in Migori, we are in Bomet, and we were in Taita Taveta. That public engagement was driven by research that was done by the Commission. And shockingly, besides the figures that were projected, it came to our attention that we are dealing with another problem of lack of reporting, especially from the male gender. And this is because of stigma. This is because they are not given an adequate environment. They go reporting to police. The first thing they encounter is to be given, demeaning word. Wewe ni mwanaume. You are coming to report a violence against you by your wife. So the next course of action is for this man to go back and seek for alternative. And the alternative is going back to drinking. And then to release the tension by now reverting to violence. And that has been proven through research. So what the Commission did, we came up with an intervention called Men to Men, where we allowed the men to speak out.
Me to Dr. Bashir.
Yes.
For example.
Yes, to speak out. And they spoke out. And one of the most interesting things that we learned from that interaction is that we have an age group that felt left out. And that is the age group between 35 to 60 years. These are the people who have moved from the bracket of youth, and they are not in the elderly circle per se. So the interventions, the affirmative actions, does not apply to this group. This group are marginalized in terms of economic empowerment. They do not get the civic education. And therefore, much as we are saying the gender-based violence increase is within the youth circle, even this group is vulnerable. So as a commission, we are trying to engage the men as champion of change. And trust you me, it is working. All we need to do is that we train the people at the gender desk that our chair has just explained. They should be very sensitive in taking reports. The communities should relook at the issues of gender-based violence across. I was dealing with an issue where communities, especially the communities I and you and Dr. Bashir come from, where they look at it as a societal issue, that instead of reporting, femicide, they will want to handle it in a communal way. And for me, that is like perpetuating more violence against women. And this is very common around Masala. Yeah. And I think we should speak out. As a commission, we are looking at addressing the issues that are not brought out to the public. Yes.
Okay. Coming to you, Patricia, then certainly after the break we'll be looking at whether then in the course of expounding on this we are forgetting about what could be another epidemic also unfolding because of lack of reporting and the perceptions that men ought not to be crying, men ought not to be complaining, and also this coming from authorities, including police officials, as the chairperson had put it here. And then when we get back from the break, Dr. Baraza as well, put into context how you can leverage on social media, which is appearing to be now a new frontier for messaging, to reaching out to the people, and the choreography of the intended message for all genders in the country and, of course, the world, because every 11 minutes a woman or a girl is killed by her loved one, according to the United Nations. When we get back from the break, the discussion continues here on The Brain.